So welcome everyone to the Public Interest Technology Colloquium. It's our second talk today. Our first one was by founder of Creative Good, Mark Hurst, and this one is by Gisele Waters. It's titled Design Research, Care Ethics, and something close to many of our hearts, Socio-Technical Challenges. Gisele is in design research in the Design Run group, and she's also been part of many extracurricular activities beyond her work. I find her quite amazing. She's got companies of her own, of course, where she does a lot of voluntary work as well. But I met her through the IEEE P7000 Standards Working Group, and then really got to know her a lot better through the IEEE P2089, a draft standard that's now almost at the end point on age-appropriate digital services framework based on the 5 rights principles for children, basically building a framework by which companies should use as a guideline to build age-appropriate digital services online. And it's such a pleasure to have her here today. Welcome, Gisele.
Thank you very much. I hope that, thank you. It's such an honor to be asked by you. But thank you for giving me the time to just simply answer any questions you may have about design research, especially as it relates to health diagnostics, the redesign of healthcare services, and the redesign, the redevelopment really of caring for others, especially in vulnerable populations. So let's open up for discussion. I'd love to have an interactive session here with you. Thank you, Katina.
Gisele, could you tell us what you do in your day-to-day work?
Sure. So we are a mission-driven, Design Run Group is a mission-driven venture studio. And what that means is with the leadership that has a very deep and wide background in IDO training. Beto Lopez is our CEO, and he has a full career working for very deep entry of and an understanding of customer experience across verticals, across functions, building service design for the likes of McDonald's, Ford, jewelry, all sorts of Fortune 500 companies, and deep government such as transportation as well, and those kinds of services. But his real desire was to go into healthcare to help the vulnerable, that really meets the needs of those where they're at, which is in poverty, with social determinants of health challenges, the disabled, the HIV, high incidences of multiple comorbidities, et cetera. And combine those two, so you have an FQHC plus a really kind of high-end private sector solution provider, and say, what is possible? How is it that we can change care to meet the needs of those that are typically not accessing these kinds of things? And so my daily work essentially entails trying to herd cats and address the needs of all these different partners in order to be the proxy for meeting the healthcare needs and the redesign of healthcare for folks that would use a service in a completely different way, they're not as healthy. We're actually going to be focusing on seniors specifically. And so my daily job now is to really develop and operationalize these healthcare services, these diagnostics that are now data-driven using AI and ML, for those that would traditionally not be able to. So it's a daily struggle, because it's a mission-driven organization that has at its core the very foundation of why we exist is to try to address something that is not in existence, and to create a value added or to create an offering in the hardest, most intractable places. Healthcare is one of those, education is another, but So that's what I'm trying to do on a daily basis.
So I haven't shared with you that in my class, a PhD and predominantly PhD class, actually, with the National Research Training NSF grant we're on smart cities or user-centered smart cities. I think that's what the grant's called. But we're looking specifically at those individuals living with dementia. Can you tell us from your experience and talking to customers that have maybe a cognitive impairment or elderly or in another state, the non-normate state, what do we have to do as researchers, as designers? What are some of the skills that we require? What do you see?
So empathy, caring, you have to care, you have to get to that, but not empathy in the way that exists in software and systems engineering, coming from our common set of knowledge, Katina, not in the system and software engineers user experience, having empathy for users, not in that way. That is I feel that whilst extremely needed, whilst absolutely required, it is insufficient to be able to meet the needs of this next most vulnerable group, like the ones that you're talking about. There is a different set of caring. It's almost like the amount of questions that has to be asked about getting anything done at the unit of work level, at the granular level, at the how does this get done with 3 departments that are trying to get data to a human being that may not understand A, how to access the computer, B, how to talk to the person and ask the right questions, C, may not do so in a native language that can get through the science, just the science translation. So it is beyond just let me figure out the specifics and the specifications and the features and the requirements for a particular product or for a particular service, so that the user experience is heard, so that the user experience is taken into account. I'm talking about the kind of empathy and care ethics and care that is way beyond that, because it defines design defines the framing of the problem, right? And so if the framing of the problem is let's just listen to a user and let's have them be a part of the process, that's still, to me, with this specific population at this time, it doesn't do enough. It's not enough. So I would say empathy, being able to ask the right questions, being able to be a pit bull public proxy for those vulnerable populations is an absolute necessity, and you just can't give up. Those are some of the qualifications.
You were generous enough to give a presentation to my class last year, Gisele, Public Interest Technology 502, and we were mentioning, or you were discussing, the importance of qualitative research.
Yes.
Can you elaborate a bit on that with regards to socio-technical challenges and the importance of qualitative research in user experience or in user design?
Right. So our world of AI and machine learning and that technical aspect of anything that could be available to a population is almost always under the frame of a quantitative answer, a what, a where, a when. Qualitative research, on the other hand, has this tremendous way of allowing you to get to the explanation, the understanding, the description of something, to understand the how of something. And so qualitative research has a huge role. And if you even actually just look at the big boys, the FAMGA or the FANGs of the world, Google, Facebook, Amazon, Apple, I would venture to say that at least half, not 5 years ago, not 2 years ago, but this year, for whatever reason, they are requiring boatloads of qualitative researchers all of a sudden. They're asking for them left, right, and center. I mean, lists and lists of qualitative researchers, all different kinds, those that are qualitative design research, those that are qualitative just customer experience. People are asking now the how question. So qualitative research, for whatever reason, has blown up in the past 2 years. And those that understand how to ask those questions, how to study them systemically, how to build upon each sub-question, and so on and so forth, how to track a feature and a question, a problem longitudinally, how to go beyond just the the bean counting and the predicting and the trying to get a sense of a model of something, but really to ask, when it comes to the socio-technical, the why and the how. And you can't get to the why and the how without stepping back and trying to use the tool sets of qualitative research.
You mentioned data-driven innovation, AI.
Mm-hmm.
In fact, my CSE students, my computer science students in the class that is represented today, many of them, they're looking at how to respond to the needs of those living with dementia with particular types of AI, and looking at it from the personal perspective. For example, wearing a token for things like wander alerts, to the potential for smart city cameras to be used for high-risk individuals as determined and perhaps logged on care platforms, and the ability for a CCTV perhaps to look at gait or to look at other kinds of biometrics to determine someone's condition. Now, of course, these are all at the moment either ideated or based in fiction or based in peer-reviewed articles. Sure. And we're going to the customers, we are asking stakeholders, and we are ideating on some very basic things, even getting out of bed, even remembering to take your medication, even ensuring, how you get back to your room when you forget about where your room is in the house. So we're not looking at pie in the sky kinds of things, although many of these have been postulated. How are you thinking about using AI in different applications? You don't have to be specific, Gisele, but could you give our class a bit of a few findings from what you've discovered so far on how AI may be used or not used?
Yeah, so I like how you couched it's ideated, and in many ways, I would argue that it's beyond ideated in the fact that the United States really doesn't have a GDPR, a General Data Protection Regulation law. And so the amount of data collection, say in the US, for existing medical AI devices or existing medical, not clinical medical, but as you know, medical devices have various categories. But let's just address the one that you said, a reminder to take medication. And how is it that we understand the senior's need, who maybe has dementia, in that instance, in that very, very specific use case? And I would argue this. It's extremely hard to, we're just doing this right now, to get a company that has a solution that's using AI and that's going to be a cumulative clinical expression of a patient's background and occurrences and incidences and prevalence of the disease, and to understand the need that particular patient or customer has for privacy. So that's kind of one setup for the answer to your question. The next setup is, in many of our design research that we did on seniors, specifically in my context, the FQHC with health diagnostics using predictive analytics, what we found out in terms of just privacy, in terms of the use of AI, is that our seniors really want care coordination. They want care. They want people to care. And privacy is much less important to them. They don't, I would use a couple of instances. There's a couple of instances where they say, I don't care who the hell has my information. I want this doctor to be able to talk to this doctor so that they can coordinate care. Not even just that they talk to each other, because that's a minimum standard, but that they coordinate my care because they now have my data. So that's sort of another addressing. So if you extrapolate to a dementia patient that may, of course, not be able to represent their own rights, and they have a proxy and they have a caretaker, I would venture to hypothesize that they would be of a similar ilk. They would say, make this easy, make it seamless. The AI aspect of it and you collecting my data is probably less important than if I get better care coordination. That's a higher priority, because especially as you get older with seniors, what you do with their data matters potentially on a daily basis to their survival, and best case scenario to their thriving, but definitely to their survival.
What are the socio-technical challenges that you see?
Well, I mean, let's put care aside, and clinical care, and even health diagnostic prevention wellness care aside. It's really just having the parties going back. I mean, this new AI procurement group that I'm in has a lot of lawyers in it, and we are starting at the terms of service understanding, at the software systems agreement understanding. And so you have these, organizations that create these contracts saying, I'm going to buy this AI from you for my set of customers and patients, and it's going to address why. It is no different. This is how Wild West it is. It is at this time in the US, in this context, no different than someone buying an exercise machine and placing it in the house, and then it gets used as a clothes dryer. That structural rawness, no systemicness about it. It assumes that all the parties involved with that technology are just going to integrate it beautifully into their workflows and streams and so on and so forth. And that's ridiculous. It's absolutely ridiculous. So it's super important to understand that the socio-technical challenges are all the things that are not being accounted for when a technology gets brought into a organization and it's supposed to be used in an integrated manner with X set of customers. I mean, that's where we're at. The devil is in the details. I mean, I just finished putting this in an email today. The granularity matters. What else can I say?
I think we might have a few questions from the group now, Gisele.
Okay.